Good afternoon, class. We're talking about Chapter 14, Drugs Used for Parkinson's Disease. In your pharmacology book, this begins on page 200. And I know we have talked a great deal about Parkinson's disease, so this will be a review here at the beginning. But just keep in mind, with the medications that are given to patients with Parkinson's disease, has to do because of the balance that is not perfect between the neurotransmitters. So normally there is a balance of dopamine and acetylcholine. So there's a disorder in the neurons, a depletion of dopamine, which causes the symptoms of Parkinson's disease. Increased acetylcholine causes drooling in the patient, tremors, which we'll talk more about. And there's two types of Parkinson's, primary and secondary. Primary being idiopathic, unknown cause. Secondary, induced by head trauma, infection, tumors, or drug exposure. Your med-surg book really didn't break it down into two types, but your pharm book does. All right, key terms. There is, well, backing up to the slide we just looked at, there's a question about your neurotransmitters on your exam, the relationship of dopamine and acetylcholine, and also there is a question from this slide that has key terms. So look at your key terms. Tremors occurring at rest, starting in the hands or face with Parkinson's disease. Sometimes it is chewing motion, smacking of the lips, certainly could be a hand tremor, and usually it's unilateral in the beginning. Dyskinesia is a loss of voluntary movements, and the patient becomes slow and jerky with movements. They have a propulsive, uncontrolled movement occurs when the when the mobility has deteriorated to cause the patient to have quickened and shortened steps, the shuffling gait, which leads to falls. And akinesia resulting in loss of movement. Signs and symptoms of Parkinson's disease on page 201 in your book. You have a diagram of a little lady there in the purple sweater, which kind of shows you as she progresses through the deterioration of her posture and her gait, and then she ends up with a profound disability, confined to a wheelchair from her increasing weakness. Constipation, your book talks about, could be an early symptom of Parkinson's, and your book talks about it as many as 10 years prior to symptoms. This could be an early symptom. So drinking plenty of water, stool softeners and laxatives. This is a picture entered of Muhammad Ali, a former world champion boxer, I guess, heavyweight boxing champion, I think, but a very famous Parkinson's patient. Obvious he had multiple hits to the head, more than likely, that caused his symptoms. All right, what is the physiologic cause of tremors? We'll just go ahead and go through these. Of patients in Parkinson's disease. It is the increase in the amount of acetylcholine in the brain. They actually have a decrease of dopamine, so don't let that trick you. The increase, because of the decreased dopamine, causes the increase in the amount of acetylcholine, which causes their symptoms. Drug therapy for Parkinson's disease is to minimize symptoms, but you cannot cure the patient. Restore dopaminergic activity. I just separated that out so you can learn to say it. Restore neurotransmitter function, slow deterioration of dopaminergic nerve cells, inhibit excess cholinergic activity, which causes the tremors. All symptoms cannot be eliminated because of the adverse drug effects, and the effectiveness of therapy may take several weeks. Management of Parkinson's, some non-pharmacologic treatments that can be used for patients are educating them about their disease, proper nutrition. They do need to get regular exercise, support services that are available to them, and patient safety with minimizing falls and then causing more morbidity with your patient. Where I put pharmacologic, page 555 chart, there is a chart in your med-surg book that I liked that goes through where the patient starts on neuroprotective medicines that can decrease future chance of Parkinson's if they start showing some signs. And when function is impaired, the dopamine agonist Sinemet is usually the #1 therapy that's used. And then partnered up with that, a COMT inhibitor, and